Welcome back to NCFH's two-part video series on occupational safety training on COVID-19 for healthcare teams. On our second installment, we'll learn from Sun River Health and their transportation team's efforts to ensure the safety of their staff and patients as they offer transportation services to patients during the pandemic. The COVID-19 pandemic mandated Sun River Health's outreach and community engagement services to re-envision their transportation practice. Their team developed protocols to enable them to continue providing limited transportation to their patients who needed it most, while adapting to the challenges of COVID-19. By instituting innovative infection control protocols, they accomplished their goal of continuing to provide accessible healthcare services while minimizing the risk of spreading COVID-19. These adaptations have not directly reduced the numbers of vehicles needed, but it has reduced the number of patients transported in a vehicle at a given time. Now let's take a look at the key steps Sun River Health has implemented to ensure staff and patient safety.
Hello, my name is James Shuford from Sun River Health. Today we'd like to share some valuable information about our health centers and the impact COVID-19 has had on our transportation services. We will also be demonstrating some prevention measures we have adopted when transporting patients. Sun River Health is a federally qualified health center with over 40 locations across the Hudson Valley, New York City, and Long Island. We offer comprehensive healthcare services such as primary care and family medicine, behavioral and mental health, dental care, women's health and pediatrics, urgent care, and enabling services like patient transportation in order to fulfill the needs of the communities we serve. The purpose of Sun River Health's transportation service is to increase the accessibility to our health centers for populations like agricultural workers who often struggle with finding reliable transportation. We serve over 9,000 migrant and seasonal agricultural workers each year, and our transportation services are an essential part of providing accessible healthcare to ag worker patients who may not have their own transportation, who often do not live near public transportation, or who may not be able to complete a trip to a health center during operating hours because of work or other responsibilities. To continue serving our farm worker community, we adapted our protocols by screening our patients prior to transportation, increasing social distancing and ventilation during transportation, and disinfection of the vehicle after transportation, all with a goal to follow federal and state guidelines, improve infection control, and continue to offer accessible care to our patients who rely on our services. Now let's begin with our demonstration on COVID-19 prevention protocols during transportation.
As we learn from Sun River Health, the key steps to ensuring staff and patient safety during transportation to healthcare services include pre-screening patients prior to transportation, practicing social distancing within the vehicle, increasing ventilation during the service, and sanitizing the vehicle after transportation. Through this video, we hope your health center has gained insight on practices that can assist in adapting your own transportation services. Be sure to watch our first video of the series on safety precautions for mobile health units with Salud Health Centers. For additional resources, visit the NCFH website at ncfh.org and find our first video on our YouTube channel as well.